Oncoplasty means when we do a breast cancer operation, we're actually trying to remove the breast cancer and at the same time create a breast that looks like a normal breast after the surgery is done. After the cancer is removed, we want that breast to look pretty. Oncoplasty is incorporating removing the breast cancer and plastic surgery techniques to make the breast look much more cosmetically pleasing after an operation. It depends upon the size of the woman's breasts, and it depends upon the kind of cancer that we're removing. Sometimes 2 hours, sometimes 3 hours, but not generally more than that. After a patient has her surgery for oncoplastic surgery, it's very similar to any other kind of breast surgery. I'll put them in an ACE wrap so that we kind of keep them almost like a tube top. So everybody knows what those are. They remember those. A tube top for at least 2 days, and then you wear a bra day and night for 2 weeks, and just to help give support to those tissues and decrease on swelling. Insurance is obligated to pay for surgery for anyone who gets breast cancer and desires to have an equalization procedure on the opposite breast. So typically, we always make sure that we call the insurance company and get their permission and they know what we're doing. But typically, insurance providers will pay for these kinds of procedures. That depends upon the provider. Some surgeons like to have their patients go home after surgery, the day of surgery, and that can happen certainly with oncoplastic surgery. But typically, I have my patients stay in the hospital overnight. And it's just for an overnight stay, and it's a 23-hour observation. In my experience, when a woman gets breast cancer, she has a lot of unanswered questions. There's a lot of worry about, oh my gosh, how am I going to do? And then we get to the day of surgery, and they're very nervous, and then all of a sudden they're going home, and they don't know what to do, and they haven't asked those questions. Keeping them in overnight for a 23-hour observation helps alleviate some of those anxieties, make them feel like their families are happy, they're happy, they go home the next day. After any kind of breast surgery, recovery time is about 2 weeks. There are very few limitations to this kind of surgery. Typically, because we're doing an operation on breast tissue, which is skin and fat, there's not a lot of pain involved. And so most women feel very comfortable, and as long as they wear supportive bras and such, going back to work is fairly easy to do. The advantage of oncoplastic breast surgery is that after a typical breast cancer operation where we do a lumpectomy, if we leave tissue, if we leave divots, take out a whole lump of tissue and then don't close the hole, then after the surgery's been done and all the swelling goes down and then radiation happens, you oftentimes get a divot in the skin, and so then the breast can look deformed. When we do oncoplastic breast surgery, we're doing two things. We're closing the divot before we even get out of the operating room, and we're using incisions that are cosmetically pleasing. So typically, those incisions are made around the nipple-areolar complex. They're made under the breast. They're made on the side of the breast, not in the middle of the breast where they're real obvious to see when you look at yourself in the mirror. So those incisions are kind of hard to see, and so when a woman gets out of the shower and she looks at herself in the mirror, she doesn't notice that anything's changed. Oftentimes, especially in women who, as we get older, we all know that you get a little droopy. And so in the process of removing that breast cancer, I will take off extra skin, move the nipple, get it up so it's perkier, and then create a much tighter breast so that we're not so droopy. They look like they're sitting up better, and they have a nicer appearance. So the benefit is that after you have a breast cancer operation, your breasts actually look quite nice. So rather than dealing with the trauma of I have breast cancer and now I have a breast deformity, you say I have breast cancer and my breasts look really good and I can forget about it. And that's a nice thing to be able to do.